This amendment protects health care for millions of Americans. It strikes language in the Republican budget that would take away the tax credits that help people afford their health insurance. My Republican colleagues, for some perverse reason, want to give more tax cuts to the ultra-wealthy at the expense of working class and middle-class Americans. I know Americans in my district are feeling exhausted, they're overwhelmed as they continue to face incredibly high housing costs, high healthcare costs, and grocery costs. And Congress should be putting all of its energy right now into relieving these pressures on working families. We should be working overtime to cut these costs for all of our people back home, to ensure that everyone, regardless of zip code, can really live a life of dignity and security. But that's not what's happening here. Instead, what we're seeing is Republicans working hand in hand with the Trump administration to make the richest people in the world even richer. This will not bring us security and stability. I believe so strongly that we have lost our way. To give more money to the very rich, they're planning to take away money for the people who rely on Medicaid for their health insurance. On the one hand, you've got another mega yacht or a jet for a billionaire. On the other hand, we're just talking about health care for working Americans. That's the stark reality of the situation. The attacks on health care in this plan are honestly just gross, and I'm having a hard time believing that anyone sitting here can go back to their people back home and let them know that they voted for something that would make their health care more expensive. So look, Americans buy health insurance and receive tax credits to help them with the crushing cost of health insurance. And Republicans want to give you less money to help you with the cost of that insurance. And why do they want to do this? So they can gather that money together and give tax breaks, not just to the wealthy, to the ultra wealthy. Why would anyone of conscience go along with this? Under this plan, you may end up paying thousands more in healthcare costs. And that's before we even add in the additional costs of prescription drugs, as my colleagues talked to, premiums for hospital stays, premiums for health insurance, health emergencies, and all the essential services that are not covered by insurance. This amendment would protect the money necessary for millions of Americans to afford their basic health insurance. And I want to be really clear about what would happen if the amendment is rejected. This plan will lead to cuts in Medicaid. We know where all the money is. We know where they're going to have to take the money from, and it will add to your healthcare costs. I also fear that these cuts could potentially kick seniors and children and people with disabilities off their health insurance. I know my home state of Vermont, like many of the states represented here, are really struggling right now with the healthcare crisis. Costs continue to go up, access is limited, small businesses can't afford the rising costs of their employees' health insurance coverage. In rural communities like the ones that I live in, patients are driving for hours to find a doctor that will accept their insurance, and Vermonters are postponing their care because they can't afford it. We have to be fighting for families who are struggling in rural America. And this plan would mean more than 30,000 Vermonters who get their health care through the Affordable Care Act would see their premiums go up by nearly $800 a year. That increase will crush the working families in my state. And people, they just want a fair shot. That's all they want. They want a fair shot. And this Republican budget will put health care even farther out of reach for these families. This Republican plan will also make it harder for Vermonters to get the mental health care coverage that they need. We have a crisis of anxiety and depression and loneliness in this country. And I do not understand, while at this time, when there is so much need on the ground, why we would pass a resolution that would strip away resources from the working and the middle class. And it doesn't have to be like this. It really doesn't. These are choices. This isn't about fighting waste or fraud or abuse. It's about kicking people when they're down. and taking the money for health care and giving it away to extremely wealthy people who don't need it. My amendment is simple. It would stop Republicans from taking away health care from Americans. And this should not be a controversial idea. Taking away health care from working people is just it's so low. You know, last night, Elon Musk, he retweeted something that referred to people in this country who rely on federal programs as the parasite class. That should reveal the kind of contempt we're talking about here. The parasite class. I don't think that my parents, because they're on Social Security, are part of the parasite class. I don't think my neighbor who is on Medicaid is part of the parasite class. So when my colleagues sit here and talk about Elon Musk in all of these glowing terms, I want you to think about who's he standing up for and who is he kicking in the teeth. I don't know anyone in my district that I would refer to as part of the parasite class. I urge my colleagues to get right with themselves and to join us in making sure that we can guarantee health care, affordable health care for all Americans. Doctors' visits shouldn't just be for the wealthy. I urge my colleagues to support this amendment. Thank you, and I yield back the balance of my time.
I'd like to thank Ms. Balint for her comments. Is there a member who would like to claim the time in opposition to the amendment? Mr. Kerry is recognized for 7 minutes.
Mr. Chair, I want to thank you, and I'm probably the newest member on this committee. And actually, I see my dear friend, Representative Marcy Kaptur from Toledo down there. Marcy and I have always believed that we can agree to disagree, but we do not have to be disagreeable. And it's something that we do in Ohio, and it's something that I hope that this body one day will do as a complete entity. Listen, our national debt is unsustainable and threatens the fiscal national security of our country. The gross national debt surpasses $36 trillion, 36 trillion, equaling a staggering 123% of our gross domestic product. This current level of indebtedness exceeds World War II levels of 119% and has doubled the average level of indebtedness since 1946. According to the Congressional Budget Office, the debt will increase to $59 trillion by 2035, when it will equate to 123% of our GDP. Now, we throw these numbers out. So a lot of people don't understand. What's the difference between a million? What's the difference between a billion? What's the difference between a trillion? So let me just put it so folks back home, as we're all sitting here not being home with our families, let me just try to put out in terms of time what those numbers means. $1 million equates to essentially, if you put it in time, 11.6 days. $1 billion equates to 31.7 years. So when we use the term trillion, what does that actually mean in terms of time? If you use it in seconds, that is 31,688 years. These are staggering numbers, my friends. The time for Congress to act is now. The longer we wait to rein in our out-of-control spending, the more significant the reforms will be needed to make to right-size the spiraling debt that we have. The primary driver of our unsustainable spending driving our national debt is mandatory spending, which is spending on autopilot that continues without congressional action. The Committee on Energy and Commerce and Ways and Means play key roles in the effort to right-size our mandatory spending and put our country on a pathway to fiscal security. In fact, over the next 10 years, mandatory outlays for the program under the jurisdiction of these committees will total remember my time, $57 trillion. That's almost 58 trillion. The instructions of these two committees to reduce the deficit by $808 billion, which is a mere remember this, 1.5% reduction in these committees' mandatory spending over the next 10 years. Congress often makes it easy task difficult. We all see that. We always have. But I am confident that we can accomplish this small reduction in the rate of growth of mandatory spending programs under the Energy and Commerce and Ways and Means Committees. Improper payments, which represent waste, fraud, and abuse, total about $453 billion in fiscal year 2023. Energy and Commerce and Ways and Means can meet their goal by reducing the mandatory spending for these programs under their jurisdiction by 2% by simply reducing waste, fraud, and abuse. I don't think anybody disagrees that that's not a good thing. Striking the instructions of these three committees will remove the opportunity to make common sense reforms to critical programs to reduce our out-of-control mandatory spending. It is our duty to our children, and for somebody like me who's missing their children tonight because we're going to be here till 9 o'clock, that's a very important thing. To take this moment to put our country on the path to fiscal security and prosperity that strikes the taking the steps needed to reform our mandatory spending. Mr. Chairman, so I urge a no vote on this amendment. But Mr. Chairman, I ask unanimous consent to submit one-pagers from both the House Budget Committee listing the total amounts of mandatory spending and proper payments, unauthorized spending within the Committees of Energy and Commerce and Ways and Means.
Yeah, without objection.
All right, so two one-pagers from the House Budget listing the total amounts of mandatory spending and proper payments and unauthorized spending in the Committees on Energy and Commerce and Ways and Means. Mr. Chairman, it is an honor to be back on this committee, and I appreciate on both sides of the aisle, the Democrats and Republicans. We're going to work together. We're going to get some things done. Anybody that knows me from Ways and Means knows that's the way I operate. But at this point, I just want to thank you all for being here because we've got a very important job to do for the American public over the next few hours. Let's get it done. With that, I'd like to yield to my dear friend, Mr. Roy, for 30 seconds.
I appreciate the gentleman. I would just add a couple things in response to these healthcare accusations. That the problem we got with Medicaid right now is all the reports you look at show that the expansion has been linked to longer wait for appointments, slower ambulance response times, greater delays in the emergency room, and significant increase in costs overall to the entire system. We're not serving people well, and people know this. And I was happy to see that, and we just saw that Bobby Kennedy was confirmed today, and that is great news for where we're headed. And when Bobby was asked about whether he still, quote, supports single payer, he said, no, I saw the absolute and total failure of the expansion of Medicaid as an indication as to why single payer would fail. And so we're looking to reform the system to make it work. When we talk about health care, we shouldn't have $25,000 a year, which is the current average for a family of four, is what the expenditure is between businesses and families going into the pockets of health insurance companies we now have insurance-run, government-regulated health management. We don't have health care. So you want to actually fix all this, we need to actually have reforms and allow states to be innovative and be able to put innovation back into healthcare. There's a lot we can do here, and our budget is designed to accomplish those objectives. I'd yield back.
Thank you, and with that, Mr. Chairman, I yield back.
Gentleman yields. Ms. Balint is recognized for 1 minute to close.
Thank you, Mr. Chair. Representative Carey, I want to say I feel your pain. My kids are also disappointed that I will not be coming home tonight, so I understand. We do have a national debt problem. I agree with you. So why wouldn't we ask those who have so much more than the rest of us to pay more? Why wouldn't we? Why wouldn't we ask them to pay more to help us close this gap? I want to wrap up by saying there are millions and millions of Americans who rely on us to be their eyes and ears in this room. We have to put working people and middle-class Americans at the center of the work that we do here, not billionaires, not wealthy corporations. Nobody on my side of the aisle ran for office to give massive tax breaks to the wealthiest Americans while the rest of us are struggling to eke out a living. Our people back home are counting on us to stand with them. I asked again for people to support my amendment, and I yield back.